As part of the CTAP project, we are reporting from Central Region, Ghana, Cape Coast to be precise. We are here to engage with some of the community members, leaders, health workers and government officials about COVID-19 intervention, healthcare and developmental projects in general. Stay tuned as we engage with the people.
Shada disika kwa na ye wa my Ghana adofo mo mayanka mo na ye nyauto ye ka mo Ghana be nyauto ye ka mo ye nyauto arade shada disika yo my Ghana ne friend no go coast ye mo mayanka mo ye nyauto ye ka mo Ghana be nyauto ye ka mo ye nyauto ye wodo ne yo nka bo mo ne yo. Yeah, oh my Ghana, me Ghana, na you are approaching now. Mommy, come on, yeah,
So we are currently at Kotokraba in Cape Coast to engage with some of the community members about COVID-19 and how it affected their lives. So stay tuned as we engage with them. Hello, sir. Good afternoon. Me pacho bo within my year neka bibi kakra fa ho.
Ofam Ahmed Abdullahi na me teaching me charge wo agri memorial na me sanso me assemblyman e wo Kotokaba tintimushe electoral area. Anja kama tumaka afamo.
Okay, Honorable, since the COVID, have you noticed any changes in health service?
Yes, I've noticed some changes in health service.
Okay, please, what are the changes?
Okay, what I've seen with respect to the health services, in terms of the physical structure, no, but I've seen them building an isolation center, that's the temporary one, with tents. If I should mention, that's the Cape Coast Teaching Hospital, which we normally call intervention. They have built that temporary structure outside the main building, which they use as isolation center. Then I also seen that with respect to washing of hands, that Veronica buckets, provision of hand sanitizer, tissue papers and other things at vantage points when you go to the hospitals or clinics and other things, where patients and those assessing patients and other things have to wash their hands and other things before they enter. So these are some of the changes that I've seen with respect to the health sector.
Okay, please. Do you have channels of communication with your community members?
Yeah, we do have that channel. I personally, as assembly member, because my community is based in the majority of them are in the Muslim community, I sometimes use our various mosques, doing mock session as a means of communicating with them. Then we also use the public address system to address the members in the community. And sometimes we do door-to-door interaction with the members. So these are the ways and means that I use to interact with my electoral members.
So please, how much did you receive for COVID health management?
As a assembly member?
Yes, please. Did you receive?
I have not received any fund with respect to COVID. I have not. But rather, I've used my own means to purchase 1 or 2 Veronica buckets and provision of hand sanitizers from my own coffers, but not from either the metro or the government.
Okay, please. Please, have you worked with the oversight committee, like procurement officers or audit generals, to know the amount that they use for the project about the COVID-19?
No, not really. I have not worked with them yet. Maybe if we are yet to experience that at assembly. But for now, I have not experienced it yet.
Okay, Honorable, in your knowledge, are they having data?
As Metro?
Yes, concerning the COVID-19.
Yes, they do have data on COVID issues. But I don't have it off air right now. We're giving information and data about what is happening.
Okay, please. So how is it captured?
If you come to the assembly, we have various subcommittees. So we have the social service, which they cater for those things. And on the social service, we have a rep from the health sector. So he will be briefing. Then we also have the sanitation department at the metro, which they take care of the those who are dead through the COVID. So these are ways of means that they do to collect the data with respect to the COVID.
Okay, please do you trust the data?
I will say yes because I'm part of the system. I will say yes, and I know because with respect to the burying of the dead body, you will see it is physical thing that they do when they are going to the cemetery, other things. You will see them even from the way they are dressed. So you can't dispute that fact. That is not true.
How are you using the data to influence your COVID response?
Okay, even the process that they use in burying the dead body itself, at first they were doing it, they will pass the main road. By now, they have been passing through the town for others to notice that it's rare. And this what's happened, this is the situation. So that's one way they are using that data to influence. And another way is that when they create the data, they will notice the area that the disease, that the COVID is spreading at a rapid speed. So they will use that data to concentrate on certain areas than others, and they will do education on that. So that's the way that they use the data. And also, it's true that the government will commit resources to the assembly in terms of COVID funds. That's what I can say about how they use the data.
Have you been vaccinated?
Myself, no, but they have given us opportunity to do that. I'm yet to go for my injection.
Okay, please kindly do so for us.
Okay, thank you. I'll do that.
That'll be all for now. Thank you for your time.
You are welcome.